The moment a person hears the words chronic kidney disease, something deep inside begins to change. Questions rise quietly in the mind. What should I eat? What should I avoid? What will protect my kidneys? For many people, the first advice they hear is simple but confusing. Eat less protein. It sounds straightforward, yet behind those few words lies a complex truth that many patients struggle to understand. Food, after all, is not just fuel. It is strength, energy, recovery, and hope. When someone living with CKD begins to wonder whether the very food that once nourished their body might now be harming their kidneys, the journey becomes both medical and emotional. The idea of a low-protein diet can feel like a strict rule, a rigid boundary that must be followed without question. But real health rarely works that way. True healing is rarely built on rigid rules. Instead, it grows from understanding, patience, and personalized guidance. This is where many people begin to realize something important. Nutrition for kidney health is not about fear. It is about balance. The human body is remarkably intelligent. Every organ communicates, adapts, and works together to maintain life. The kidneys quietly filter waste, regulate fluids, and maintain balance in ways we rarely think about. When chronic kidney disease develops, those silent workers become more fragile, and protecting them becomes a priority. But protecting them does not always mean depriving the body of the nutrients it needs to stay strong. This is why many experts emphasize that dietary advice must always consider the individual person, not just the disease. Among the voices that have helped guide this conversation is Dr. Mathew R. Weir, whose insights into kidney health have encouraged a thoughtful and balanced approach to patient care. Dr. Mathew R. Weir has often emphasized that managing CKD requires more than simply following generalized dietary rules. It requires understanding the patient's stage of disease, overall health, and nutritional needs. A person's body is not a textbook example. It is a living system that responds uniquely to every change. For some individuals with advanced kidney disease, reducing protein intake may indeed help decrease the workload on the kidneys. Protein metabolism produces waste products that damaged kidneys must filter. So in certain cases, lowering protein intake can slow stress on the kidneys. Yet the story does not end there. Protein is also the building block of muscle, immune function, and recovery. When protein intake drops too low, the body begins to weaken. Muscles may shrink, energy may fade, healing may slow. Suddenly, the very strategy meant to protect health can begin to threaten it. This delicate balance creates one of the most important questions CKD patients face. How much protein is enough, and how much is too much? The answer is rarely the same for everyone. Some patients benefit from moderate restriction. Others may require a more balanced intake to prevent malnutrition. Understanding this difference is where careful medical guidance becomes essential. It is also where knowledge replaces fear. When patients learn that their diet can be tailored to their body rather than forced into a universal rule, a sense of control returns. They begin to realize that managing CKD is not simply about eliminating foods. It is about building a thoughtful relationship with nutrition, one that supports both kidney function and overall strength. And as this understanding grows, another realization slowly emerges. Protecting the kidneys is not just about eating less of something. It is about learning how the body works, respecting its limits, and making choices that nurture health rather than restrict life. As people continue their journey with chronic kidney disease, something deeper begins to unfold beyond medical instructions and dietary charts. At first, the focus is often on restriction. What must be reduced? What must be avoided? What must be controlled? Protein becomes the center of attention, almost like a silent character in the story of kidney health. Patients hear different opinions, read conflicting advice, and sometimes feel trapped between fear and uncertainty. One doctor may suggest reducing protein, while another emphasizes maintaining enough nutrition to keep the body strong. This moment of confusion is where many people begin to feel a quiet tension building within them. They start to wonder whether every meal they eat is helping their kidneys or slowly harming them. It is a heavy feeling, carrying the responsibility of every bite. Yet the truth, hidden beneath this tension, is far more empowering than most people realize. Chronic kidney disease does not demand blind restriction. It demands understanding. The body is not an enemy that must be starved into compliance. It is a partner that must be supported wisely. This is the turning point where knowledge becomes more powerful than fear. Experts in kidney health often emphasize that the stage of CKD matters greatly when making dietary decisions. In earlier stages of kidney disease, the kidneys may still function well enough to handle moderate protein intake without significant harm. In these situations, excessively restricting protein can actually weaken the body more than it protects the kidneys. Muscles begin to shrink quietly, energy slowly fades, and the immune system may lose strength. Patients who once hoped to protect their kidneys may unknowingly create a new challenge for their overall health. This is why thoughtful guidance becomes so important. Dr. Mathew R. Weir has often highlighted that kidney care should always be individualized, not generalized. His philosophy reminds patients and healthcare providers alike that every person's body tells a different story. Age, activity level, stage of disease, body weight, and nutritional status all play critical roles in determining the right approach. When doctors carefully evaluate these factors, the diet becomes a strategy for strength rather than a rule of deprivation. Yet in the middle of this journey, a quiet suspense often develops in the minds of patients. They begin to realize that protecting the kidneys is not as simple as cutting protein from the plate. The real challenge lies in finding the delicate balance between protecting kidney function and preserving the body's strength. Too much protein may place stress on the kidneys, but too little protein can gradually weaken the body's foundation. It is like walking a narrow bridge where balance determines the outcome. This is where personalized nutrition becomes more than just medical advice. It becomes a form of wisdom. Patients who learn to work closely with healthcare professionals begin to understand that the goal is not perfection, but balance. Instead of fearing food, they begin to approach meals with awareness and confidence. A well-planned diet may include controlled portions of high-quality protein, combined with foods that support overall kidney health. This approach allows the body to maintain muscle, energy, and resilience while still protecting kidney function. The suspense that once caused anxiety slowly transforms into clarity. Patients realize that they are not helpless in the face of CKD. They have tools, knowledge, and guidance that allow them to take meaningful control of their health. The teachings and insights shared by experts like Dr. Mathew R. continue to inspire this balanced perspective, reminding patients that the goal of kidney care is not simply survival, but a life supported by thoughtful decisions, steady discipline, and informed confidence. As the journey with chronic kidney disease continues, something powerful begins to take shape within the patient's mindset. What once felt like fear slowly transforms into awareness, and awareness begins to grow into confidence. The person who once looked at every meal with anxiety now begins to see nutrition as a tool rather than a threat. This transformation does not happen overnight. It develops through understanding, guidance, and the realization that health is not built through extreme restrictions, but through thoughtful balance. Many people living with CKD eventually discover that the most important part of managing their condition is not simply following a list of rules, but learning how to listen to their bodies and work closely with knowledgeable healthcare professionals. Nutrition becomes part of a larger philosophy of care, one that respects both the kidneys and the strength of the entire body. Protein, which once seemed like a dangerous enemy, begins to appear in a more balanced light. It is neither completely harmful nor completely harmless. It is simply a nutrient that must be managed wisely. This understanding removes a great weight from the mind. Instead of constantly worrying about what must be eliminated, patients begin focusing on what must be preserved: energy, strength, resilience, and long-term health. The body thrives on nourishment, and when nutrition is planned carefully, it becomes a foundation for stability rather than a source of fear. This balanced perspective is echoed in the teachings of many kidney health experts, including Dr. Mathew R. Weir, whose work continues to influence how patients and clinicians approach CKD management. Dr. Mathew R. Weir has often emphasized that thoughtful, individualized care is the cornerstone of protecting kidney health while maintaining overall well-being. His perspective encourages patients to move beyond rigid dietary myths and instead focus on informed choices guided by medical knowledge. When patients begin to adopt this mindset, they discover something remarkable. Managing chronic illness is not only about avoiding harm, but also about cultivating strength. Every decision, every meal, every step toward better understanding becomes part of a larger commitment to living well, despite the challenges of disease. Yet even at this stage of clarity, the journey still requires patience. CKD is a long-term condition, and its management demands consistency and discipline. There will be moments when uncertainty returns, when patients wonder if they are doing enough to protect their kidneys. In those moments, the most important reminder is that health is not defined by perfection, but by persistence. Small, informed choices made day after day can gradually shape a healthier future. The power of knowledge, combined with the support of medical professionals, gives patients the ability to navigate this path with greater confidence. What once felt overwhelming becomes manageable. What once felt frightening becomes a challenge that can be approached with courage and wisdom. And perhaps the most inspiring realization of all is that the human body possesses an incredible ability to adapt when it is supported properly. By embracing balanced nutrition, personalized guidance, and ongoing learning, individuals living with CKD can protect their kidneys while also preserving the strength and vitality that define a meaningful life. The journey may not always be easy, but it can be purposeful, empowering, and filled with hope for the future. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.